Master E.K. So first, as an introductory part, we'll try to know what is the nosode. Nosode primarily came from the Greek word called nosos, which means the disease. It is defined as a potentized form of medicine prepared from the pathological material or disease affected parts. నోసోడ్ అంటే ఏంటంటే మన శరీర భాగంలో ఏదైనా ఒక భాగం వ్యాధికి లోనైనప్పుడు ఆ భాగం నుంచి మనం ఒక చిన్న ముక్క తీసి లేదా ఆ భాగం నుంచి వచ్చిన సెక్రీషన్స్ ద్వారా మనం పొటెంటైజ్ చేసి ఒక మెడిసిన్ని ప్రిపేర్ చేస్తాం. దాన్ని నోసోడ్స్ అంటాం. వాటిని నోసోడ్స్ అంటాం అన్నమాట. For example, sputum which is infected or infected blood or infected pus, infected tissues obtained from the patient suffering from a particular disease. So this is the basic definition of the nosode. So these nosodes are useful in both acute and chronic cases. So we will see how these nosodes are useful in acute and chronic cases. These nosodes are deep acting, long acting and anti-miasmatic and polycrust remedies which can clear many symptoms in our constitution. So ఈ nosodes ఏంటంటే మనకి యాంటీమయాస్మాటిక్గా కూడా పనిచేస్తాయి అండ్ దీస్ ఆర్ వెరీ డీప్ యాక్టింగ్. అంటే మనకి మన శరీరంలో ఉన్న ఎన్నో ఏళ్ల నుంచి మనం సఫర్ అవుతున్న వ్యాధుల నుంచి అండ్ మనకి ఉన్న ఈ మయాజమ్స్ వాటి నుంచి కూడాను మనకి రిలీఫ్ ఇస్తాయి అన్నమాట. సో నోసోడ్స్ ఆర్ యూస్డ్ యాజ్ ఇంటర్కరెంట్ రెమెడీస్ యాజ్ వెల్. Intercurrent remedies are one which removes the obstacles in the path of the cure and bring about recovery in the patients. Ante when we are treating a case, we may find some obstacles while treating them. It may be in the form of a mechanical cause or in the form of the miasms or in the form of the mind of the patient. So these nosodes will clear the path, or else sometimes these nosodes will clear the disease as well and they pave the path for the cure of the case. Nosodes are also used as prophylactic remedies. Prophylactic remedies are the remedies which are used in epidemics where these remedies are given to prevent the disease, or else they are given to remove the residual symptoms so that the individual won't get affected by the disease. అంటే ఈ ప్రొఫిలాక్టిక్ రెమెడీస్ అంటే ఏంటంటే ఉదాహరణకి మనకి ఒక ఎపిడమిక్ వచ్చింది. ఎపిడమిక్ అంటే ఒక సెట్ ఆఫ్ పీపుల్కి ఒకటే డిసీజ్ రావడం. ఉదాహరణకి మనకి ఇప్పుడు రీసెంట్గా కోవిడ్. సో ఇలాంటి టైంలో ఏంటంటే ఈ నోసోడ్స్ మనకి చాలా ఉపయోగపడతాయి. అంటే ఆ డిసీజ్ ఆ వ్యాధి మనకి రాకుండా చేయడానికి, ప్లస్ ఒకవేళ ఆ వ్యాధికి సంబంధించి కొన్ని లక్షణాలు ఏమైనా మనలో ఉన్నప్పుడు వాటిని క్లియర్ చేసి కంప్లీట్గా ఆ వ్యాధి బారిన పడకుండా ఉండడానికి మనకి నోసోడ్స్ సహకరిస్తాయి అన్నమాట. సో ఫర్ ఎగ్జాంపుల్ డ్యూరింగ్ ద కోవిడ్ బాసిలినం 30 దిస్ వర్క్డ్ యాజ్ a good nosode which prevented many cases from getting affected by the COVID, and it also helped us in curing the cases who got affected with the COVID anamata. So this is the one of the uses of the nosodes in epidemics. In chronic ailments, nosodes help in many ways, like in clearing the resistance to the improvement apparently by the similar medicine. Ante see, if we select a similimum to the patient suffering from a chronic ailment and still we cannot see the recovery, there might be some obstacle in the form of miasms or in the form of his lifestyle, in the form of his thought process, which might be creating an obstacle to for the commencement of the cure. So in such cases, nosode will clear the obstacle. And when there is poor response to the remedy, so when we will select a similimum for a certain case, but still the patient's response to the remedy is very poor, and the susceptibility of the patient towards the medicine is very poor. So in such cases, Nosodes will help by improving the vitality of the patient. A vitality increase ayinappudu, the patient definitely he will get susceptible to the medicine, to the similimum, and then the cure will commence. And one more point is, when the patient doesn't rally around, that is when the patient is not cooperative. Here, just now Master Garu said a case about the Medorinum 1M, 10M, sorry. In some cases, though the similimum is indicated, we know the similimum, but the mentality of the patient or the mindset of the patient or the reluctance of the patient will cause an hindrance to the cure. So in such cases, if we are able to make out the symptoms, or if we are able to just take out clear mental symptoms of the patient, and we are able to give the indicated nosode to the patient, then it will lead to the cure. I'll give the example as said by Dr. E.V.M. Acharya. There was a case, he was an engineer. He came to Dr. E.V.M. Acharya with some digestive ailments, and he was Master gave him some medicines, and still he did not get any improvement. So slowly he started attending the classes of Master Garu, and then after listening to the classes of Master Garu, he portrayed himself to be the patient of a lycopodium. So as said by the patient, he portrayed himself with the lycopodium symptoms. Master gave him lycopodium 200, around 2 to 3 doses, but there was no improvement in the case. Then Master Garu got a doubt, and he made it possible that he will talk to his family members, and then he came to know that he is very suspicious man, and his suspicion levels are so high that this was the case told by Master Garu just now. He used to write the dates of the periods of that lady, of his wife, and every month he used to check whether she got the period in time or not. So basing on this symptom, Master Garu gave Medorinum 1M, Medorinum 10M for the first dose. And there was slowly the mentality of this person changed, and then he started allowing his wife to come to the clinic for her medicine. And for few months, again after few months, the symptoms recurred. Again his suspicion levels increased, and he became very violent, he became very erratic, and he started harassing his wife very much. Then Master Garu gave one single dose of Medorinum 50M, which totally cleared his mental symptoms. And then the first thing he did was he took away the book or the diary in which he was noting the menstrual cycles of his wife, and he threw away the book, and he started taking care of his wife. So this is one example of the case where patient himself will become hindrance for the cure. So in this case, after giving Medorinum, not only his mental symptoms but also his digestive issues also got cured. So one more is, it is indicated in the sequel of the infection, that is where there is a progressive debility, uneasiness for reasons which continues for after previous illness. Patient says he was never well since. Ante previous ga ante munupat like idvaraku vachina paata edana due to the previous sickness, the patient got cured from the previous sickness, but still there were some hanging symptoms like weakness or digestive issues or some sort of depression, and the patient, whenever he comes to the doctor, he will say constantly, doctor, since then I was not well. I got so and so disease in the previous history, and since that disease I am not well. So in such cases also, when you give a nosode, indicated nosode, that will clear the hindrance, and it will give the pavement to the cure. That is it will complete the cure of the indicated previous remedy. When best selected remedy fails to act, అంటే మనం ఒక సిమిలిమం సెలెక్ట్ చేసినప్పుడు ఆ రెమెడీ కనుక అది కరెక్ట్గా ఉంటుంది సిమ్టమ్స్ ప్రకారం, బట్ అక్కడ ఆ పేషెంట్కి ఆ రెమెడీ పని చేయదు. సో ఇటువంటి కేసెస్లో కూడాను nosode em chestundante, it will clear the symptoms and it will and the indicated remedy will act. So one more is when there is paucity of symptoms, that is presentation of the symptoms is vague, not clear, leading to the improper totality of symptoms. Here nosodes will clear the path for proper totality. So there will be few cases where the symptoms are very vague. మన దగ్గరికి కొన్ని కేసెస్ వచ్చినప్పుడు మనకు ఒక టోటాలిటీ అన్నది సరిగ్గా ఫ్రేమ్ అవ్వదు. అటువంటి కేసెస్లో కూడా ఆ ఇండికేటెడ్ సిమ్టమ్స్ ప్రకారం ఏదైనా ఒక నోసోడ్ మనకి సెలెక్ట్ అయినప్పుడు అది వేసినప్పుడు ఇట్ విల్ క్లియర్ అండ్ ఇట్ విల్ బ్రింగ్ ఆన్ ద సప్రెస్డ్ ఆర్ డార్మెంట్గా ఉన్న సిమ్టమ్స్ని బయటకు తీసుకొస్తుంది. దిస్ నోసోడ్ విల్ బ్రింగ్ ద డార్మెంట్ సిమ్టమ్స్ into the limelight and then we can select the proper simillimum. So in case of chronic miasms also, the nosodes will help. When there is a confused state, the nosode will clear much and establishes an order and indicates the correct remedy. And in acute cases also, nosodes will clear the diseased state either as intercurrent remedy or help other more similar remedies to complete the cure. For example, acute diarrheas kani or else there will be some acute sudden bleeding conditions. Acute diarrheas lo in when a patient comes to us or with an acute diarrhea, he says, doctor, I went out, I went for a dinner or else I went out for a journey and then I got diarrhea. Seeing such symptoms, we may give Naxwamika. So even after giving Naxwamika, we may not see the proper result. And the patient still again he comes to us telling, doctor, no, I have still my diarrhea is not set, I am still having the pain abdomen or green stools or so and so. So even after seeing all these symptoms, again we might give some remedies like aloes or calotropis or something like that. So still when in such conditions, even after giving indicated remedies, when there is no result, in such cases medorinum 30 will cure the condition. Similarly, in painless and bleeding conditions, rectal bleeding conditions, syphilinum will help. In acute fevers also, where there will be profound weakness, even after giving the simillimum, the patient may have profound weakness. The fever will come down, but we may see symptoms like loss of appetite and loss of hair and severe weakness, and the patient, because of the weakness, patient may go into the prolonged anxiety issues and everything. So in such cases, usually we will give acid phos. In some cases, even when acid phos is not working, or China also, China is not working, in such cases syphilinum 200 will help to clear the case. So nosodes are also used in the cases of infertility. Here infertility may be due to the inheritance or infertility may be due to the previous suppressed gonorrheal history of the spouse. So here we have a case as described by Master Garu. A lady came to the clinic with the symptoms of primary infertility, and then she also had severe leukorrhea, which is very excoriating, offensive, and she had very severe burning pain. In this case, Master Garu initially gave symptoms, medicines like pulsatilla and to her, but these medicines didn't work. So then after prolonged and continuous case, like repeatedly he was asking to the patient about the family history. Then after a few visits, he came to know that her husband has suppressed gonorrhea in his previous history. So here the causation is the suppressed gonorrhea of her husband, which has affected her fertile life. So in such cases also, if medorinum will be given, medorinum is indicated and it will clear the symptoms of the female and it will establish the fertility. So, and we can see many inherited ailments are also cured by the nosodes. Inherited Inherited derangements may also include the even mental disorders also. So now we came to, we just in brief, we observed in what all cases Nosodes can be used. So here we should know, it's very important to know how Nosodes can be used, that is the posology. In what potency Nosodes should be used. Nosodes cannot be used in lower potencies. They should be used only in the potencies 200 and plus, but there are some exceptions for few Nosodes which they can be used safely in lower potencies, that is in the 30s. For example, as said previously, during COVID, Basilinum 30 was really helping very greatly to cure the many COVID cases. In those conditions, we were giving Basilinum 30 with depending upon the intensity of the symptoms, we were giving Basilinum 30 with a gap of 6 hours or 12 hours. In few cases, we had to repeat Basilinum 30 for every 3 hours also, where there was severe congestion of the lungs and SpO2 levels are below 60. So this is how we should select the potency of the Nosodes while treating the cases. So a doctor by name Dorothy Shepherd, she was the first lady who told us that we can use Nosodes in 30 lower potencies very safely in a book called Magic of Minimum Dosage. So we have commonly used Nosodes are Basilinum, Tuberculinum, Syphilinum, Medorinum, Pyrogenum, Sorinum. These are the commonly used Nosodes. There are also some other Nosodes which are not proven completely, which may include Melandrinum, Carcinosin, and some other bowel Nosodes. So we'll try to know about these completely proven Nosodes by looking through the cases treated by Master Garu. These Nosodes, as I said, they are polycrust, anti-miasmatic, and they are deep acting. So first we will see a case treated by Master Garu by giving tuberculinum. So it was the case treated by Master E.K and Master E.V.M. Acharya Garu around 1977. So there came a lady by the age 24 years with very severe asthmatic attacks. So as said by her husband, she was very weak, lean and depressed lady, always melancholic, and she had repeated attacks of asthma, and asthmatic attacks are associated with burning in stomach, and she had digestive ailments as well, and she was very exhausted, she was very weak, and due to this physical weakness and physical health issues, she developed a sort of disinclination to work, and she became very sensitive. She had very severe anger issues, and anger issues were so severe that she used to beat her kids. But all these developed due to the physical ailments. So, and she always craved for the cool weather, and she had air hunger. Even in winter, she had craving for the cool breeze, and she craved for chilly foods and sour foods. And if we go to the previous past history of this patient, she had history of convulsions with a typical pricking sensation in the extremities. And she had a history of depression as well as insanity conditions, where she went to the condition of hallucinations that someone is beating her, someone is burning her, or someone is going to harm her. And particularly when she was eating the food or when she was taking her lunch, she had an apprehension that somebody is beating her from her back. So all these symptoms, and one more typically, she developed all these symptoms repeatedly for every 3 years after every pregnancy. And basing on all these symptoms, she was given Carboveg 200 initially. After 5 days, she developed high fever, and she became very weak, and she had severe body pains. Seeing all these symptoms, Master Garu gave Bryonia 200, and within 1 day she got relieved. But then again she landed into severe leukorrhea, and she became very weak, and she had symptoms like asthma after head bath and digestive issues. Seeing this, Master Garu gave Beretta Carb 200 and she had relief for few days. And again she developed few symptoms where she landed into severe anxiety issues. ఇక్కడ ఏంటంటే తనకి ఫిజికల్ ఇష్యూస్ తగ్గాయి, ఆస్తమా తగ్గింది, ల్యూకోరియా తగ్గింది, వీక్నెస్ తగ్గింది, డైజెస్టివ్ ఇష్యూస్ తగ్గాయి. అండ్ నౌ షీ ల్యాండెడ్ ఇంటూ an anxiety state where she had a fear that she is going into an incurable disease or and she had anxiety to do any work. So here Master Garu gave argentum nitricum 200. For 3 days she was fine with no symptoms, both mentally and physically she was fine. And again after 3 days suddenly she developed severe pain in the extremities, and due to this pain she was weeping like anything. Seeing this, Master Garu gave Ignitia 200, but there was no relief. And then he gave Cactus 30 because she also complained constriction in the chest with the painful extremities. Then Cactus 30 gave relief only for couple of days. Later she was given Cupromet 200 because she came with symptoms of severe painful extremities, and here she developed a typical symptom that all these pains were aggravating with strong odors. In this condition Cupromet 200 gave very good relief and all her previous symptoms also got down. And this Master Garu just gave placebo for 4 to 6 weeks, and later again same symptoms repeated. So Cupromet 200 was given in 2 doses. And later when he gave Cupromet 1 ml also, and after few weeks she was fine. Later on again she developed asthma, pains taggayi ikkada, malli respiratory symptoms ekkuva ayipoyayi. Here Master Garu gave Tuja 200 and she was better for 6 to 8 weeks. But again she developed all the previous symptoms like melancholy, weeping, restlessness. అంటే ఇక్కడ ఏమవుతుంది, ఫిజికల్ సిమ్టమ్స్ తగ్గితే మెంటల్ సిమ్టమ్స్ పెరిగిపోతున్నాయి, మెంటల్ సిమ్టమ్స్ పెరిగిపోతే ఫిజికల్ సిమ్టమ్స్ తగ్గుతున్నాయి. సో సీయింగ్ ఆల్ దీస్, మాస్టర్ గారు అబ్జర్వ్ 3 points in this case. In the first point is action of the remedies is not sustaining. Whatever medicine we are giving, it's giving relief only for a couple of days. And the second observation was her hysterical tendencies are continuing in the background. So whenever she is getting a relief from the physical ailments, she is getting hysterical. Either she is getting anger issues or she is getting melancholy, or she is going into the depression, or either she is going into the violent condition. And the third observation was that psoriasis, syphilis and psychosis were combined in a complicated manner, and these were causing hindrance for the improvement of the case. So basing on these 3 symptoms, and one more important symptom was that there was an inherited history of tubercular tendencies in her elders. So basing on all these symptoms, we'll think that Master Garu might have given tuberculinum. No, first he gave Ignitia 200 to her again, which gave considerable relief for few weeks. But again the symptoms relapsed, and then he gave Ignitia 1M. So Ignitia 1M relieved her from her melancholy, but then she started getting violent again. She started throwing things, she started beating, and she started screaming like a child. In this condition, Master Garu gave Chamomilla 1M to her, and for few weeks she was better, and again she landed into the depression and she was weeping like anything. And then Master Garu gave Pulsatilla 1M, but this did not give any relief. Then observing all the above points, Master Garu gave tuberculinum 200, which gave considerable improvement to her condition both mentally and physically, and her appetite improved, and her digestion is improved, and she was very emaciated previously. The emaciation came down, and her mental symptoms are also started improving. So he waited for few weeks by giving placebo, and after few weeks again the symptoms relapsed. So Master Garu gave one more dose of tuberculinum 200, which sustained only for few weeks. And again he had to repeat tuberculinum in 1M potency, where the symptoms again relapsed with an increased intensity. So this tuberculinum 1M gave considerable relief for almost 7 months. The patient was absolutely fine. She was doing all her daily course without any difficulty, and she was absolutely fine. And after 7 months, when again the symptoms relapsed with a mild intensity, Master Garu gave the final dose of tuberculinum, which relieved her completely from both her mental and physical ailments. So here the tuberculinum acted as both antisoric and antipsychotic remedy and helped for the cure of the patient. So this is one remedy, and we will see one more remedy called medorinum, which is also a polycrust remedy, deep acting anti-miasmatic remedy. It covers all the 3 miasms, but predominantly it acts as an antipsychotic miasmatic remedy. So here usually medorinum is indicated in the cases where there is a history of gonorrhea, suppression of the gonorrheal discharges. Here, but we should be careful that medorinum is not only the single remedy for the suppressed gonorrheal discharges. There are many other remedies like thuja, which act on the cases of suppressed gonorrheal discharges. But here this is also one of the indicated remedies. As I said previously, an infertility case which was cured by giving medorinum by master because husband has a history of suppressed gonorrhea. So we will see one more case where the medorinum cured the mental derangement of the case. As we discussed previously, the person was very suspicious, and he was very erratic, and he was very violent, and he suspected his wife very much, and medorinum 50M, I said 50M but not 50M, sorry, medorinum CM was the last dose given by Master Garu after repeated doses of medorinum 200 and 1M, and it cleared the case completely. Similarly, one more case was there. Actually this patient did not take medicine from Master Garu, but we will just see how a case will turn into insanity if proper medicine is not given in time. He was the devotee of Master Garu, and he was a very orthodox person, and he was very punctual, and he was attending all the classes of Master Garu, and he was doing all the spiritual rituals very regularly. Nobody knows that he is a very suspicious and violent person. He was very violent towards his wife. He used to torture her a lot, both mentally and physically. He used to lock her in the house. So nobody knows about this. Finally, they had shifted to another place, and he ended up with the insanity in his later years, because when a proper treatment is not given in such cases in the initial days of mental derangement, the patient may land into the insanity. ఈ కేసులో కనుక మాస్టర్ గారు చెప్పారు, మెడోరినం ఇచ్చి ఉంటే అతను ఇన్సైన్ కండిషన్లోకి వెళ్ళేవాడు కాదు, బట్ హీ డిడ్ నాట్ అప్రోచ్ మాస్టర్ గారు ఫర్ మెడిసిన్, అండ్ ఫైనల్లీ హీ ల్యాండెడ్ ఇంటూ ఇన్సానిటీ. Similar case was there where when Master Garu went for a village camp, there a patient came, and he sincerely gave his case history and everything. He took medicine from Master Garu, and finally Master Garu called and said to the volunteers, it seems, though you people are giving this medicine to him, he is not going to take the medicine, he will just throw away this medicine in the gutter and he will go away. And he did the same thing as said by Master Garu, like, because this is one of the predominant nature of the Nosodes. That is, they are very suspicious, and they doesn't believe anyone. వాళ్ళకి అసలు ఆ నమ్మకమే ఉండదు. ఏదో ఎదుటి వాళ్ళు ఏం చేస్తున్నారు, ఎలా చేస్తున్నారు, మనకి పని చేస్తుందా లేదా అన్నది తెలుసుకోవడం కోసం వాళ్ళు వెళ్తారు, అదేమీ వాడరు. వాళ్ళ ప్రీవియస్ హిస్టరీ కనుక చూస్తే ఒక పెద్ద ఫైల్ ఉంటుంది వాళ్ళకి. రకరకాల డాక్టర్స్ దగ్గరికి వెళ్తారు, 10 రకరకాల టెస్టులు చేయించుకుంటారు, బట్ వాళ్ళకి ఏంటంటే నమ్మకం ఉండదు. ఇంకొకటి ఏంటంటే దే విల్ జస్ట్ చెక్, అసలు ఆ డాక్టర్ సరిగ్గా మందిస్తున్నాడా లేదా, మంచిగా మాట్లాడుతున్నాడా లేదా, ఇవన్నీ చూస్తూ ఉంటారనమాట. దిస్ ఈజ్ ద టిపికల్ యాటిట్యూడ్ ఆఫ్ ద మెడోరినం పేషెంట్ అనమాట. సో these are the some chronic mental disabilities in which nosodes gave very good relief. And I'll present one more case of chronic pneumonia which was cleared by the bacillinum. Actually, a case came to our clinic. They brought a 3-year-old boy to our clinic with severe pneumonic attacks, very repeatedly with high fever. The boy was just 3 to 3.5 years old when he came to our clinic, and he was in a very devastated condition where he was given high antibiotics, high So after 3 days, the patient was brought to us with considerable relief. So we gave the placebo and we asked the patient, we asked the parents to give him only the tincture of the placebo and Senega together thrice a day. So for a few weeks he was fine, and again he came back with increased with the same symptoms. So in this process we were giving bacillinum, antimtart and spongia as per the indicated symptoms in repeated doses, and finally tuberculinum, we ended the case with tuberculinum 200, where the boy got complete relief. Almost for the past 10 years he didn't get any attack of asthma. Here in this case we should observe one point. When the boy was brought to us, he was kept on high antibiotics and he was given very repeated nebulizations daily. So in such cases the body will get accommodated to the allopathic medicines. So in such cases sudden receding of the allopathic medicines may bring on fatal symptoms to the case. So ikkada em cheyalante, we have to decrease the allopathic medication in gradually. Tapering should be in a gradual form anamata. So first initially for the first visit I asked them to continue the nebulizations, but not very frequently, maybe once or twice in a month. So after that, after a period of such taperings in a span of 2 to 3 years, he completely stopped using nebulizations, antibiotics and everything. And in such cases, one more important thing we should notice that we should observe the the allergic conditions of the patient. We should just see while asking the case history and symptoms of the patient, we should note down what all the symptoms, what all the foods which are aggravating the condition of the patient. For example, if we see this case which is treated by Basilinum, here this boy had severe allergy to citrus fruits, and he has severe allergy to sour foods, and he had severe allergy to the pastries or chocolates or heavy foods and non-veg. So I strictly told them to stop all these things for a few years, and they did as we said, and the boy got very good relief. This is one case. And one more case of infertility in which Cifilinum gave good result. A lady came to our clinic with the symptoms of irregular menstrual cycles, amenorrhea, and severe sinus issues, and repeated rhinitis with change of weather, and she also had severe gastric issues. Though she had good relief with the open air, but she had severe exacerbations of the sinus issues and rhinitis with least exposure to the cold climate. And if we consider her mind symptoms, she was very sensitive lady. She was working as a lecturer in some college, so she had a lot of stress managing the things at home and at the college. So due to this stress, she landed into severe anxiety issues, where she was weeping constantly for very trivial things. So seeing all these symptoms, first we gave Pulsatilla 200, which gave some relief to her sinus issues, but the PCOD issues and her irregularity of menses and this primary infertility was still continuing. After repeated doses of Pulsatilla 1M and other indicated remedies, we did not find any good relief of her infertility issues. Though Pulsatilla gave good relief from her irregularity of menstrual cycles and PCOD issues, her infertility issue continued to be the same. So finally, seeing all the previous history, we gave one dose of Cifilinum 200. Then for few weeks we gave the placebo, and after few weeks we gave one dose of Cifilinum 1M, and we waited for 3 months, and again she didn't conceive, and finally we ended up with Cifilinum 10M. After 4 to 6 weeks, I think, she conceived, and she delivered a baby girl who is very healthy, and she had a normal labor. So this is one of the infertility cases in which Cifilinum gave good results. Now we will discuss about acute cases in which Nosodes will help to get the good results. Recently, an old lady, she landed into the symptoms of fever with severe cold and cough and some respiratory symptoms, chills and everything. She had a history of travel previously, so basing on the symptoms, I gave Basilinum 200. She got relief only for 1 day, and again I gave Basilinum 1M in this case. She got relief for 2 to 3 days, fever subsided, but again her daughter called me saying that the patient had severe earache. So here I gave, asking all the symptoms, that she had severe pain in the ear, throbbing pain, and she felt as if an insect is in the ear. So basing on the symptoms, I gave Pulsatilla 200. This Pulsatilla relieved the ear symptoms. The pus started oozing, but again fever relapsed. This time the fever was around 104 degrees, and the patient was very weak. So now again I repeated with, I started with Basilinum 200. Again Basilinum 200 gave temporary relief, so I had to repeat the Basilinum 200 2 times, but the case was in a standstill condition. Then I gave one dose of Basilinum 1M. The fever came down to normal after 2 days. In between, I was giving water dose made by the tissue salts like ferrum phos, natrum sulf, kali sulf, lecithin, calimore. After 2 days, again the fever relapsed. Now the respiratory symptoms got down, they are relieved, but the patient still has fever with no other symptoms. She was a bit weak. Then I gave streptomycin 30 as there were no clear symptoms. For evening, by evening the temperature got down, and the next day morning also she was fine. Again after 10 o'clock the temperature gradually started rising up, and she had symptoms of headache, severe body pains, increased thirst, restlessness, loss of appetite and everything. Then I gave a dose of Bryonia 200. So by evening again she got relief, till next day morning she was fine, and again after 10 o'clock the symptoms started recurring. So it was the same cycle. Depending upon the symptoms I had to give China also once, but the cycle was the same. So finally the temperature came to a standstill condition where the temperature levels were between 101 and 102, but the patient was becoming very stuporous. ఇక్కడ పేషెంట్ ఏంటంటే చాలా మగతలోకి వెళ్ళిపోయింది ఇంకా ఆవిడ. అండ్ షీ వాజ్ నాట్ రెడీ టు ఈట్, షీ వాజ్ నాట్ రెడీ టు డ్రింక్, అండ్ షీ వాజ్ జస్ట్ ఇంటూ ఏ సెమీ, ఎట్లా అంటే ఒక సెమీ కొమటోస్ కండిషన్లోకి వెళ్ళిపోయారు. సీయింగ్ దట్ స్టూపరస్ స్టేజ్ వీ గేవ్ ఓపిఎం 200 1 dose. సో అప్పుడు ఏమైందంటే షీ వాజ్ లిటిల్ బిట్ బెటర్, షీ వాజ్ టాకింగ్ and her temperature levels again came down, but after 2 days again the same cycle started. All these there was one problem is that the patient was staying somewhere else, and all these symptoms we were asking by phone and we were giving the medicines. So then I asked her daughter to see the pulse and to check her BP and then inform me all these readings. So that day her temperature was more than 103, but the pulse was between 60 and 70, and her BP was around 100 by 60. So seeing all these symptoms, we gave 1 dose of Pyrogen 200, which gave little relief. So we had to repeat Pyrogen in 1 m potency. So then she got relief for 2 to 3 days, but again the same cycle started repeating. Morning she was fine, and after 10 or 11 o'clock in the morning again the temperature started coming, but this time the temperatures were very high. Ikkada 101 100 అలాగ రాలేదు, the temperature was more than 103. So finally I asked her, and the stuporous condition was also worsened. The patient was getting much more stupor. She was not eating, she was not drinking, she was not even able to go to the washroom. So seeing all these conditions, I asked her daughter to go for investigations like electrolytes and hemoglobin and everything. Her hemoglobin was fine, but the electrolytes decreased to 120. Sodium levels were around 120. So we gave her a drip. So we gave her IV infusion of the sodium, but still it did not help us. So in such cases usually family members will be scared, and they asked us, we'll take her to the hospital. So it was their decision, so we couldn't say no. We gave, but we said before taking her to the hospital, give her a dose of Baptisia 1 m. So after giving the dose of Baptisia 1 m, the temperature came down to 101 degrees by the time the patient was shifted to the hospital. But the electrolyte levels and her heartbeat or the pulse, everything were very low. So the patient was, as a part of routine treatment, she was kept on antibiotics, and she was resuscitated with IV fluids and everything in the hospital, but patient condition was not improving, and she was getting weak day by day. So we had to give China 200 in 2 doses with a gap of 24 hours, but even that did not help the patient to come out of her extreme debilitated condition. So the hospital staff, the doctors, they took her to the CT scan, chest MRI and everything, where she was diagnosed with mild focal infections in her lungs. The lungs had a mild infection, and there were mild ischemic foci in her brain. So seeing all these symptoms, we finally gave her Basilinum 10 m. This Basilinum 10 m, after 6 hours of giving this Basilinum 10 m, patient regained her conscious. She started talking to everyone. She started recognizing everyone. Her stuporous condition got down, and after a span of 10 days, she said that she is hungry and she asked for some food. That is the last dose of the medicine given to the patient. And I said, just as her condition is improving now, tell the hospital people that we'll take her away home. Luckily, the hospital doctors also agreed to send her back to home. So we just kept on her water dose. We gave her water dose with all the necessary tissue salts for 1 week with decreasing frequency gradually. Now she is doing absolutely fine. Time and okay. So this is one of the acute cases which is cured by the nosodes. So ikkada while treating such cases, as we discussed previously, we should consider many points while treating the cases. ఇక్కడ మనం ఏ పొటెన్సీలో నోసోడ్ ఇస్తున్నామో ఆ పొటెన్సీలో ఆ కేసులో మనం ఆ కేసుకి నోసోడ్ ఇవ్వచ్చా లేదా, అండ్ ఆ పేషెంట్ యొక్క లైఫ్ స్టైల్ ఎలా ఉంది, డైటరీ హ్యాబిట్స్ ఎట్లా ఉన్నాయి. సో వీ షుడ్ కన్సిడర్ ఆల్ దీస్ ఫ్యాక్టర్స్ వైల్ గివింగ్ ద మెడిసిన్స్. So this is what I studied from the notes given by Master Garu, and my humble thanks to Sridevi Akka who provided a good information about from where I can get all these notes. Vasudeva.